All right, let's continue on with the show. As we always cover a lot of issues, politics, business, economics, which is, of course, with the downturn in the economy, but also the alternatives that really are not mentioned out there. This is almost like I keep telling everybody almost daily. This is like hurricane preparedness. Who's hiring? Who isn't? What are the layoffs? What are the numbers with tourism, lack of tourism out there? Also, when it comes to medicine, the wave of the future is, of course, going to be telemedicine out there, and this is going to be interesting to see where a lot of this goes. Dr. Bill Mallon. I've known Bill Mallon for several years. He is a doctor down, are you ready for this, down in the Vero Beach area, and we talk quite often. His group, GlobeChek.com. The goal of telemedicine, tell me what this is about, and why is everybody under the radar raving about this?
Well, Ed, as you know, out of any problem, usually there's solutions. And, we've been working on telemedicine, tele ophthalmology for the past almost 6 years. So this has really brought to the forefront the importance and basically telemedicine is now talked about. You see they're talking about on national news conferences. And really what it does, the beauty of this now is with the quarantining and keeping social distances, that's really hard to go to your doctor and keep social distances. You're walking into a crowded waiting room. You're around a lot of people who are sick. So telemedicine is the ability for your doctor to see you in a virtual visit. So you can have a visit at home with your doctor.
Now, by the way, you can check out his site. It's GlobeChek.
GlobeChek.
Yeah, GlobeChek. But it's CHEK. GlobeChek.com. So tell me, let me play for you a clip here. I want to get more into this. This is from Dr. Lloyd Minor. Here's clip number 12. He is the dean of Stanford University School of Medicine. Listen to what he says about how big telemedicine is increasing.
Increase in the amount of telemedicine, people seeing doctors over the phone or online. Is that a permanent shift, do you think, in American healthcare?
I do think it's a permanent shift. During the entire month in our adult healthcare delivery system, we had about 1,000 virtual visits. In one day this week, we had over 2,500 virtual visits. And what we're seeing is that we can deliver a lot of healthcare safely and effectively through a virtual visit. And I think that's a change that's been a long time in coming, and I think it will be permanent.
All right, so we understand the pros. You'll be able to go in, you can do it, it's quicker amount of time. But what are still the glitches with telemedicine?
Well, first of all, widespread acceptance. The biggest problem with adoption that we were experiencing over the last 5 years, we're shouting from the rooftop, telemedicine, tele ophthalmology. We could do your eye exam in under 10 minutes without you coming to our office, provide you with essentially what studies have shown is equivalency to a face-to-face visit. Well, the problems with adoption were reimbursement. And it's a totally new platform, so people are very resistant to change from what they're used to. They're used to the model of you take a day off of work, you go to the office, you get your eyes dilated, you have your eye exam, and you go back to work the next day. This whole paradigm has shifted, and what we're now creating is the ability for people to have care at their time, at their convenience, and provide them with quality care. So reimbursement now, also legislative issues. I mean, we had to be licensed essentially to read GlobeChek scans. If you had an eye exam in Washington, D.C. on my GlobeChek, on our GlobeChek kiosk, I had to be licensed in Washington to read that. So they've broken that down. Interestingly enough, the federal government in the VA system and Indian Health Services has been very far ahead of the curve. Wow. They knocked down all those barriers to telemedicine. So you could actually be a VA doctor and read telemedicine scans across all 50 states. But the individual states were holding up those licensure types of things. Now the federal government came in and said, boom, it's gone. So we've moved telemedicine 10 years down the road, and now insurance companies are reimbursing for telemedicine. So, if you get reimbursed on a telemedicine visit for $10, you can't even cover your overhead. So now they're changing, and right now they're allowing telemedicine to be reimbursed the same as a face-to-face visit. So the advantages, and we've just been called by a major hospital in New York where their ophthalmologists are all sick. They can't even provide care. We're sending a GlobeChek kiosk up to them so they can actually provide emergency eye care and urgent eye care to people and do it in a very safe, protected environment. So not only is the patient protected, but the healthcare workers are now protected from being exposed to COVID. This is really going to shift the dynamic. And with GlobeChek, we've been screaming again for years. We improve access, cost, and quality. So we hit all three things. When you look at healthcare, you usually get 2 out of 3. Telemedicine and GlobeChek in particular, when it comes to eye care, gives you all three.
This is, when you look at it, this would be the right way to go. Who's been the biggest obstacle in getting telemedicine up and ready to go?
Well, as you know, the government, red tape, all of the different things, insurance, adopting. I mean, we can show insurance models. We've met with insurance companies and show them how they could save hundreds of millions of dollars on eye care alone. We could save the federal government in the billions of dollars on eye care services, and yet trying to convince them of that. I'll give you an example. The VA health system, the VA, the busiest VA hospital in the United States is in Florida. That VA hospital spends $2.8 million providing care to veterans outside of the VA hospital because they can't provide for that care in the VA hospital. There's a 28-day mandate. You have to be seen within 28 days in the VA health system if you need an eye exam, but they can't provide it. They've got a one-year backlog. So we have been talking to them. We're going to the VA. But here's how the government works, interestingly enough. When we talk about that $2.8 million they're spending above their normal budget, that money's been allocated from a completely different fund from the federal government. So we can say to them, we can save you that $2.8 million by you implementing GlobeChek. We'll take care of all your veterans. We'll be able to screen them appropriately. Those who need the most care will be brought in immediately. Those who don't and are doing okay can come back the next year and have a GlobeChek scan.
Doctor, go ahead.
That pile of money, that $2.8 million that we could save the federal government is looked at as a completely separate money. They don't care. They don't care that money, because it's already been allocated from a different fund. And that, unfortunately, is some of the barriers we're up against.
Everybody's been talking about telemedicine and why not. You know, my father's a minister down in Melbourne, and I understand one-on-one, contact, to help out people and visit them while they're in the hospital, but that's always the last place you want to go because that's the first place you get sick. This would also keep, you would think, some of the healthcare workers a little safe going through telemedicine. Dr. Bill Mallon on our Newsmaker line, the website GlobeChek, CHEK, GlobeChek.com. What is this? I got to ask you this because we were talking about this issue earlier in the show. What does this do to jobs? I'm just kind of curious with that. Healthcare. Well,
actually, it's interesting. Some of the fear of adoption of telemedicine, and particularly tele ophthalmology, when we've been presenting this and talking around the country, and there's the fear that doctors think they're going to be replaced. The reality of that is they're going to be busier, but they're going to be busy doing the things that they most need to do.
Yes.
So the amount of disease we're going to be uncovering, I mean, if you look at eye care in particular, 80% of blindness is preventable in the United States. If we simply had everyone GlobeChecked every year, you would literally wipe out 80% of the blindness that's in the United States today and worldwide. So a very simple eye exam can be very inexpensive and very accessible can wipe out 80% of blindness, which down the road, how much do you save in terms of monetary things? But the doctors themselves, because there's so many people who don't get an eye exam, once you start scanning all those people, you realize that half the people who have glaucoma in the United States have no idea they're walking around with a blinding eye disease. The diabetics that we uncover, there's an epidemic of diabetic retinopathy. We pick all that up at an early stage and prevent blindness. What is the social impact of preventing blindness in a 45-year-old?
Yeah, Dr. Mel, let me
social and economic cost.
Let me throw this one at you. Years ago, when they tried to push Medicaid expansion, which was part of the Obamacare here in Florida, we actually interviewed those that you would think, okay, because who would not want to expand allowing medicine to those that needed the most? And we actually interviewed, and forget about the party line, we actually interviewed people who sat back and said, listen, I don't mind the idea of Medicaid expansion, and I got about a minute and a half left here, but my child is on special needs. My doctor can't even see him now. Why do I want to expand it? Would this not allow for the doctor to see more patients out there?
Absolutely. And just when you bring up Medicaid and the underserved in our population, GlobeChek, we actually are going into the health center here in Vero Beach, and we are going to be providing eye care services. We can do this across America. We've reached out to Indian Health Services. We've reached out to the VA. All of these places, we can increase access, increase quality, and provide it in a very cost-effective way. There's absolutely no reason for adopting this other than inertia and some of the fears of people losing their ability to bill for a certain test or do other things. I mean, we could go into the way that electronic health records have been so backwards as well, and how this will decrease the cost of retesting and the redundancy of testing with wasted money after visit to another doctor when you just had the same thing done at another doctor for a second opinion. There's so many ways that we can save money, increase access, increase quality, and now save people from the exposures in public places. So we can do this in a very safe environment.
Dr. Bill Mallon, GlobeChek, GLOBE Check, CHEK, GlobeChek.com. Telemedicine is the right way to go. I want to have more of this conversation with you down the road. I think we could do another 20 minutes. Hey, good to have you on today.
Yeah, thanks, Ed. Appreciate it. Stay safe.
Man, you're quite welcome, man. Telemedicine.
Yeah.
See more doctors out there.
I've never understood the whole concept of people wanting to slam the brakes on modernization. Let's say let's modernize.